COVID-19 infections has prompted the Health Minister, Zweli Mkhize, to instruct provinces to be battle-ready. While South Africa is not in a third wave just yet, the possibility is still very real. The latest data shows increases in infections in the Northern Cape, Gauteng and Limpopo, among other provinces. Let's zoom into the situation in the Northwest with Limpopo Health MEC, Dr. Phophi Ramathuba. Doc, good morning. Thank you for talking to me. Let's start with the situation around vaccinations and the crunch, it seems, to get as many healthcare workers vaccinated as possible as the Sisonke project winds down. We're seeing queues in Gauteng, queues in KwaZulu-Natal. What are the reports you are receiving on the ground in as far as your vaccination sites are concerned? And if there are queues, what are some of the reasons being cited for those?
Morning to last season, morning to all your viewers out there, and thank you for inviting us. What we can indicate, like now I'm at Jane First Hospital, where we do, yes, have quite a number of health workers that have responded, but this probably was worsened by the fact that we are here to also assist the vaccinations of our traditional health practitioners who, when we were busy with the phase 1A, were left out, but they are also healthcare providers, and we felt it's important to vaccinate them. But otherwise, when you look at all the other facilities, the numbers are in a manner which we are able to manage them. The reason why you're seeing the increase of healthcare workers this particular week across the provinces in the country is because this is the last week for Sisonke, and they, of course, like you have earlier on indicated, they've got to meet the 500,000 deadline, the target of 500,000. And the other issue is that remember that we had planned properly to say on each and every week how many are we going to vaccinate depending on the number of dosages that we are going to receive. However, the program was also disrupted by those reports that came for the safety of our people when the ministers announced that we suspend J&J until such time all safety measures would have been established. So that was not our own making. So it has, of course, disrupted the schedule. Hence, you see us chasing that particular deadline. But that doesn't mean that we are ending the vaccination of healthcare workers, which is one message that we need to emphasize out there. From Monday, the only issue here is that this particular stage that we're in, as government and as healthcare workers, we were participating on the phase 3B clinical trial of Sisonke, which is ending this particular week. From next week, Monday, Department of Health National will be giving us dosages direct from them to us, which are going to be administered by provinces. So, for instance, as Limpopo province, next week we'll be continuing with mopping up all the outstanding healthcare workers. In the beginning, we said we are estimating our healthcare workers, both public and private and independent, to be at 59,000. Currently, we are at around 30,000. So meaning we still have another 30,000 that we need to vaccinate. They will be vaccinated utilizing the dosages that we are going to be given directly by the National Department of Health.
I see. So the two phases are flowing into each other and basically just continuously to ensure that it continues seamlessly is the situation you describe. MEC, the Health Minister has had to send a note out to the provinces basically saying that while technically we are not in a third wave of COVID-19 infections, but actually it's looming, that third wave, and the situation is quite concerning. Limpopo, among those provinces that registered a sharp increase, I'm told it's about 47%. How worried are you?
I am not sure on the sharp increase that you are referring to, because the report that we have as Limpopo currently is that, yes, indeed, we when I look at the national analysis, that the status, we are still managing the situation as a province. We are not one of those provinces that has reach an alert phase. We just have the Waterberg district, which when you look at the active case index risk, for Waterberg, it has surpassed the 10. And once it surpassed the 10, we put it on an alert phase because it's at 11. While the Capricorn district, it's still at 5. And the whole province, on average, is at 4.5. That is the latest figures that we got from the National Department of Health. What is currently happening is that, look, a district like Vembe is still at 1. We still one of those provinces that has got the lowest number of active cases. If you look at Limpopo and Eastern Cape, yes, we are worried because since we have started to see the increase in number of cases, they are continuously we are not going down. That calls for action to be taken. If you look at the Waterberg district that I've already indicated to, it is where you for instance, this particular week we've seen a cluster outbreak in one of our correctional services. We've already dispatched our team to can be able to look into that because those are people who are within the congregated environment. So it's easier to spread the virus. Hence, we are also prioritizing inmates when it comes to phase 2. So in terms of us as a province, we think the situation is currently within the manageable situation. We have not seen the admission rates in our hospital sharply increasing. We have not seen the death increasing like when we were dealing with the second wave.
So, while that is good, what you are reporting in terms of the situation being manageable at this moment, what are you doing, though, to set systems in place to be battle ready, particularly around issues of oxygen availability, bed space, bed capacity? We saw what happened with the FH Ordendal Hospital, for example.
Our messages will continue to be consistent in the fight of the pandemic, and we will continuously repeat the statement that there's no healthcare system in the world that can ever say they are ready to deal with any form of pandemic. What must happen is that our first and foremost strategy is to deal with the community, to deal with the virus within the community, which is where the problems are. So we are meeting with our mayors, especially in those affected municipalities, where we are also spreading the message that let's reduce and not wait for the president one day to tell us that for funerals you need to be 50, for weddings. We are strengthening those particular messages of people to avoid gatherings, because if they do that, we will continue to maintain the situation. Now, when all has failed, of course, you're quite right, people will need hospitalization. What is currently happening, we do have our facilities continuously to be upgraded, looking at preparation for COVID-19. We never stopped after the second wave. We continue to invest on the infrastructure to deal with COVID-19. We are continuously with the process of recruitment of healthcare workers who can be specifically to come and assist with the COVID-19. We also appreciate the boost of starting to vaccinate our healthcare workers, because when you look at this form of primary prevention of vaccination, it will come in handy and assist that, unlike during the second wave, what deepened the crisis was the fact that most of our healthcare workers were infected and they fell ill, and then we end up not having staff to treat those who are very sick. So this time around, we have already vaccinated those who are in the call phase. Our nurses, our doctors, our cleaners, they are ready to deal with this virus in case we do see the spike and more people get to be sick. But lastly, on the issues of getting our oxygens, we are ready. The FH Ordendal Hospital, people always make me, I think, confuse the two facilities. The facility that got banned, it's a ward that had a temporary area where we admit patients who are not requiring a ventilation, because all our facilities must have a ward that deals with COVID-19. But 8 kilometers from that hospital, that's where we have our 92 COVID-19 beds, which were dedicated, and of those, 50% were of high-risk patients. Have got also the ventilators. Yeah. They've got their own ICU there. That hospital is not the one that was affected by fire, so it's still intact. The current one in Modimo, that's why even those patients in Modimo, FH Odendal, we have been able to transfer them to Modimo MDR COVID-19 hospital. So the hospital is still fine, and all our districts and all our beds, we are working on increasing the capacity of the bed.
All right. Dr. Poppy Ramathuba, the MEC of Health in Limpopo. We seem to be losing your line as well there, MEC. Thank you for your time there. That is the MEC of Health in Limpopo, Dr. Poppy Ramathuba, really reporting that from their side they are battle ready, and at this point not overly concerned in terms of, the numbers seeing a sharp spike. She says that it's still within manageable numbers in the various districts, with the Waterberg district being an area of concern. That's the one that they've put on alert. I think they're saying it's about 10% of the tests that they do returning a positive result, if I understand those figures correctly, and I'm putting that proviso there. There is a possibility that I'm not understanding them correctly, so please do forgive me if I'm not getting it correctly.